questions focused on decreased granulocytes, especially neutrophils, and the associated fungal infections, Candida, systemic, Aspergillus, and Mucor. Question 1. Systemic candidiasis in neutropenia. A 58-year-old man undergoing chemotherapy for acute leukemia develops fever, chills, and hypotension. Blood cultures grow Candida albicans. Which of the following immune defects most likely predisposed him to this infection? A. Decreased CD4 plus T cells. B. Decreased B cell maturation. C. Defective neutrophil function. D. Deficiency in complement C5C9. E. Decreased natural killer NK cell activity. Correct answer, C. Defective neutrophil function. Explanation: systemic candida infections, especially candidemia, are strongly associated with neutropenia or impaired neutrophil function, such as in patients receiving chemotherapy. Neutrophils are essential for defense against fungal infections in the bloodstream. Why not the others? A. CD4 plus T cells, involved in mucocutaneous candida, not systemic. B. B cells, defend against encapsulated bacteria, not fungi. D. Complement, important for Neisseria infections. E. NK cells, key in viral defense. Question 2. Aspergillus in neutropenic host. A 45-year-old man with a history of stem cell transplant develops fever, cough, and hemoptysis. CT scan of the chest shows nodular lesions with surrounding ground glass opacities, halo sign. Which of the following best explains his susceptibility? A. Decreased mucosal IgA. B. Impaired neutrophil oxidative burst. C. Impaired cytotoxic T cell activity. D. Reduced splenic macrophage function. E. Decreased dendritic cell antigen presentation. Correct answer, B. Impaired neutrophil oxidative burst. Explanation: invasive aspergillosis occurs in immunocompromised patients with neutropenia or chronic granulomatous disease, CGD, where the respiratory burst is defective due to NADPH oxidase deficiency. Neutrophils are vital for killing aspergillus via oxidative burst. Why not the others? A. IgA, mucosal defense, not systemic fungal control. C. T cells, more relevant to viral or intracellular pathogens. D. Spleen, filters encapsulated bacteria, not fungi. E. Dendritic cells, present antigens but not primary in fungal defense. Question 3. Mucormycosis in immunocompromised patient. A 60-year-old man with poorly controlled diabetes and neutropenia presents with facial pain, fever, and black necrotic eschar on the palate. Biopsy of the lesion reveals broad, non-septate hyphae branching at right angles. Which of the following is the most likely pathogen? A. Candida albicans. B. Aspergillus fumigatus. C. Rhizopus species. D. Cryptococcus neoformans. E. Blastomyces dermatitis. Correct answer, C. Rhizopus species. Explanation: mucormycosis, caused by Rhizopus, is associated with neutropenia and diabetic ketoacidosis. The hallmark finding is broad, non-septate hyphae with right-angle branching invading blood vessels, leading to tissue necrosis. Why not the others? A. Candida shows budding yeast, not ribbon-like hyphae. B. Aspergillus, narrow, septate hyphae with acute 45 angles. D. Cryptococcus, encapsulated yeast, CNS tropism. E. Blastomyces, broad-based budding yeast, not invasive molds.